So really, when we look at true whole healing, it's looking at the endocrine system. Well, a lot of people think of the endocrine system as more like estrogen, progesterone, testosterone, but they don't think of like necessarily thyroid and cortisol and adrenal health, right? Whereas many will go to the endocrinologist also for blood sugar imbalances, which we're going to talk about prediabetes, diabetes, and insulin resistance. And so I'm going to do the best I can to not really drive what happens medically, but more as kind of an overview of the endocrine system and how, when healing the endocrine system from hormones to energy and from stress to strength, we are doing really a deep dive of whole healing. Does that make sense? Because the endocrine system is actually really what I think of. And when I talk to patients, it's really our master messenger network. It's like that internal communication network that really governs the processes in your body from your brain down to your vital organs. So when I think of the endocrine system, or truly physiologically, it's like, okay, the brain tells an end organ what to do. The hypothalamus tells the pituitary, which is both in the brain structure, what to do. So when that communication happens internally, it's either going to go message the thyroid, or it's going to message the adrenals, or the pancreas, ovaries, or testes between the pituitary and hypothalamus. And then what happens is these end organs then begin to release powerful chemical messengers that then travel through the bloodstream to help you regulate your metabolism, your growth, your energy, reproductive health, or even female and male health, and even down to emotional stability. And most of this is happening in the gut, right? So that's why we talk about why it's so important for not only the brain to function to these end organs, but for the communication, and that master messenger internal communication is happening in the gut. So when all of those systems, if that makes sense, are working, then we know that our network of communication is functioning. Then we're going to feel this alignment inside our body. We're going to have the energy that we need. We're going to feel vibrant. But when one of those systems is out of sync, it can, I think of it almost as like this domino effect that can really influence every aspect of your health depending on, depending on where it touches. Does that make sense? So it's like a big system, and I'm trying to narrow it down so that you can understand. Maybe I'm having these thyroid symptoms, which I gave a handout in your portal for you, or maybe I'm having these these symptoms, and maybe that's more, connected to our female health, for example. So it kind of all depends where we're at in the journey and how we're pushing. What I do want to say is when we get to like the adrenal health, I want you to remember and think about when we're in that stress state, that's where our cortisol is going to shut down all the other systems because our body truly believes it's running from that saber-toothed tiger, or a big massive truck is going to hit us, and we are really stressed out. And so what I want to hit home is when we're in that constant doing, being, ding, 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 duh, that's stress for the body because the body's trying to keep up with our brain consistently telling the body what to do. But it's not real stress. It's stress that we have been brought on for ourselves. So if all of our backbones, like our vitamin D and our cholesterol, are backbones to all hormones, those are why it's important. That's all going to be shunted or shuffled, as you hear me say, to cortisol. And it can't build the other systems for our body to function. Then what I'm not going to talk about, but that we want to think about as we think about like learning how we are and who we are as an individual, what medications could be helping us, blocking us, stopping us from having the energy or the metabolism or the health that we really are creating. Does that make sense? Okay, great. So again, the brain is communicating, the hypothalamus in the brain is communicating with the pituitary gland to produce, for example, thyroid, right? So if we're thinking about thyroid, it's going to tell the thyroid to release T4, and then the gut breaks down T4 to T3, which we're going to talk about in a minute. And T3 is your active hormone. I do want you guys to take that down and note that. Many practitioners only test TSH and T4, which drives me bananas because I don't really know how much T3 you have, and are you converting T4 to T3? So this feedback loop with the stress or the non-stress works to keep your body in the homeostasis. However, if you're under chronic stress, toxins, processed foods, you have blood sugar imbalances, insulin resistance, poor sleep, or gut imbalances, this can truly disrupt the harmony in your living, vibrant being, which could then lead to fatigue and mood swings and sleep disturbances. Um, and I don't love talking about weight because I want you to figure out what works for you, as you guys know, but it also will, if you're in that cortisol shuffle, you'll feel that weight gain around, the center, like that tubular piece, especially that women feel. So when you start to understand this system, this is really, I believe, on a deep level, how you get to reclaim your health. And then you're not at the mercy of your symptoms. You're learning to listen and respond and really truly support your body in doing what it's aligned to do. So, am I going too fast, or is that makes sense?
Yeah, makes
Okay.
sense.
Great. So thyroid health, that is your metabolic furnace and the energy structure of you. It's this small thyroid, sorry, this small butterfly gland that's at the base of the neck. And so why is the thyroid so important? Is it's your body's energy. It tells your body it's cold, it tells your body it's warm, and it really regulates your metabolism, your heart rate, um, your digestion, and your brain function. So what happens is the hypothalamus tells the pituitary to release TSH. That's what most medical practitioners, everybody's going to test that. And it'll say, I need more thyroid hormone, right? And so that is the connection. And every single cell in your body depends on thyroid to regulate metabolism. When your thyroid is working normally, 80% of it is T4 and only 20% is T3. But T3, like I just said earlier, it literally has 3 to 4 times the hormone strength of T4. And so that is so important because, like I mentioned, I when I test the thyroid, you're going to see all the testing in there so that you understand it. There's about 10 or 12 different markers that I test in the very beginning, including the autoimmune anti-TPO for Hashimoto's, which is very prominent in women these days. And also TSI, which would be possible autoimmunity to Graves' disease. So Graves' disease is more where your thyroid is hyperactive, right? You may be losing weight, you may be feeling like your heart is racing, which can come when you're overtaking too much thyroid, whereas Hashimoto's is more low thyroid, low energy, fatigue, but it's autoimmunity. So it means that your body is actually attacking the thyroid organ, right? So it's not working like it should. When I think of these conditions, I also think about the toxicity that's around us. So why would you have Hashimoto's? Why would you have Graves' disease? Do you have an ongoing infection in your body? Are you using a large amount of chemicals around you? Are you working in an environment where there's chemicals that you're taking in? Because you're like, if we think of a glass of water, right? We think of so much of that. Once your body starts to get toxic, I explain it like it starts to overflow the cup. Once we get that extra amount of toxicity in the body and we're overflowing, that's when the toxicity has to go somewhere. And unfortunately, you've heard me say, we're not a clean environment. The thyroid gets hit as well as other organs, but it's up to myself as a practitioner to figure out what system is getting hit that's causing that, right? But many women, they will tell you that you can never come off of thyroid hormone. And I know that that's not true because I've personally come off of it and I've personally taken patients off of it once their hormones are become balanced, right? Once we've removed the toxicity and we get the system to work together in communication. So the thyroid is really, it's really an important organ, right? And in order for us to break down the inactive hormone T4 to T3, we need like iodine, we need the right amount of selenium, we need zinc in order to break that down. If you're nutrient deficient in any of those items, as well as some other amino acids, then you could have gut dysbiosis, you could have chronic stress, and or you could be dealing with toxins like we just talked about, like fluorides in the water, or pesticides. So the liver and gut also play an important role in converting T4 to T3 so these healing systems can work all together. Um, so like I said, I mentioned and I gave you a handout on thyroid symptoms. So if you're feeling like you have some of these symptoms, low thyroid is more like sluggishness, weight gain, depression, not a really good appetite. You kind of feel apathetic. Like that's kind of low thyroid. Whereas high thyroid, where you have an increase in thyroid hormones and that feedback loop is make more hormone, make more, you know what I mean? And it's like on overdrive, those symptoms are going to be more like anxiousness, like could be irritability, could be nervousness, even feeling like heart palpitations or night sweats. And so your metabolism has this huge impact on your hormones, and it's trying to figure out the balance between energy and fat burning and metabolism. And so really making sure that your thyroid is working is important because it can throw off all those lifestyle factors that we always talk about, like your gut health, your sleep, your exercise, regulating the nervous system, having the energy that you need to have in order to balance yourself. So it's really key for you to communicate back to your practitioner, for you to listen to your body, kind of like what we talked about earlier, and look for signs and symptoms, right? Watch your stress because stress can throw all of that. Ask yourself, where am I pushing too hard? And even honestly standing up for yourself. The thyroid is all about, if we look at Chinese medicine and we look at health and healing, the thyroid is all about speaking your truth and who you are as an individual. So those patients that I've worked through to process that thyroid chakra, right? And to move through for them to be able to speak out, to be able to be who they are, be able to show up in, their ways of being and not be quiet and hold everything in. I have seen that heal the thyroid as well. So really understanding that piece and knowing kind of where you're at is so important. I also believe I put in your portal as well, um, foods that can help you increase your metabolism. So now I want to go on to adrenal health, I'm not going to do a deep dive here because we've talked about it a lot with stress and whatnot, but it is your stress and resilient gland. And it's like the two little hats that sit on top of your kidneys, and they're so small, but yet they get used so much in our world and really dysregulate our nervous system when we're in that stress cortisol shuffle. So your cortisol hormone, your adrenals, sorry, the medullary cortex is responsible for releasing cortisol and adrenaline. So really cortisol, like we talked about, should be high in the morning, not high, but within this range in the morning, drop off, have a little bit around 3 to 4, and the melatonin will kick in, right? So I call cortisol your get up and go hormone, and it's so important in your role of metabolism, inflammation, your blood sugar balance, and immunity. Why do I say it's so important in inflammation? What people don't realize is if they are constantly in their stress state, you're inflaming your body. So cortisol is your friend, but it's also not your friend, right? So you want to use it to the best you can. Even for me over this week or so, I kind of would get into my head and then I'd step back and I'd go into breathing, right? To slow my nervous system down. So when we're in that state of energy, start to be aware of where am I? Am I stressed out? So short term is adaptive. But yet, when we get into chronicity, anytime, post 60 to 90 days, that's when our adrenals become overworked. And that's when other misfiring hormone signals can begin to happen. And so we know that life can be demanding, making stress really a factor in many of our lives. But how can we lower that stress? Because it has really become common in our life to be in that stress state for long periods. What I do want to say is many patients like, how can I completely get rid of stress? We don't want to completely get rid of stress because our body needs some stress to feel like we want to keep living our vitality and our life. But it's when we get in that chronic, never slow down, that's the step that you don't want to get into. And so, thankfully, our body does have wonderful ways of letting us know we're stressed. It could be our emotions become off, we could be fatigued, anxiety, depression, but often many ignore them. And so I want you to all be aware of, like I was just sharing about myself this week with patients. You know what I mean? Like, I stepped back several times. I'm sharing with you when it's indicated. I stepped back several times and was like, what are you doing? And I would just stop. I would ground my feet. I would hold on to my heart for a moment. I would take some deep breaths in, get back into my body, think of something a little bit joyful, and get back on track. I will tell you, I did not learn this overnight. It has been years of learning to do that because I was somebody in that doing like we've talked about before. So let's not ignore the signs and let's really become more aware of them. The other thing is that cortisol plays a huge role in our sugar regulation. Otherwise, like we talk about blood glucose regulation. So if you burn your adrenals out and you get into adrenal fatigue and our cortisol drops too low, your sugar may not be adequately maintained, and we can have drops in our sugar. And so we really want to not get ourselves into that state because over time, that stress can have dramatic effect on you, right? So, think about, am I overworking? Am I a perfectionist? Do I have unresolved emotional trauma that's taxing my system over time? If I do, how can I change my way of being and showing up for ourselves. And there's several ways that we have talked about that I've listed on ways to really stop and change our stressful situation. Like, maybe, is this important to me right now? Maybe you want to breathe before you say something to somebody. Maybe it's that we have to learn how to be a little bit more flexible because change happens. Like maybe we need to not take the risk because this risk is too stressful. Maybe it's, a wide variety of resources with family and friends that we can develop that don't trigger us. So what are ways for you to think about that you could start to be aware of it, and how could you step back and maybe try not to be so perfect and really focus on more of who you have, what your way of, no, sorry, who you are and what your way of being is. And so I know I listed out different practice skills, which I've used with my patients over the years that they could think about. And the biggest one that I want you to think about that is with you every single moment of every single day is to stop and breathe. If anything else you take from the stress piece that we're talking about here, I know that you have breath. Because the truth is we cannot heal a burned out body in a stress state. It's impossible. So, what are ways that you could start showing up for yourself and being aware of your stress? Um, so from stress, I now think of blood sugar balancing and metabolic health. This is the dance between our fuel, our hormones, and our mood. And I will tell you, which I know because we've been together for a while, that blood sugar regulation is one of the most vital systems in the body. But I will tell you, it's often the most misunderstood. Sugar is the fuel for your cells to run on with thyroid. Your body works hard to keep this fuel in a steady state, not too high, not too low. But like our modern diets and our chronic stress and the regular eating patterns that we have has really skyrocketed into this epidemic of blood sugar dysregulation, which then becomes tied to brain fog, Alzheimer's, inflammation, weight gain, hormonal imbalances, right? So we really want to keep our sugar stabilized. And so I shared numbers in the portal about like what is a good number, what is a low number, because many of the practitioners will say, they're not going to tell you have low blood sugar until you probably hit 65 or 60. However, for me, when I work with patients and I look at their fasting sugar, which is your fasting glucose, I suggest 90 to 95 at all times so that you don't have a roller coaster ride. So as you start to have that sugar drop below, you starting to get in the 80s and the 70s, that's when your cortisol is coming in to help balance the blood sugar. Does that make sense? So it's this balance that we want to do, and you want to watch your systems. So many individuals also don't realize that it's not pre-diabetes right off the bat. What it is you're getting all of these signs and symptoms, whether it's fatigue after you eat, whether it's having to have sugar after you eat, whether it's anxiety, um, you're not remembering well, your difficulty, or your forgetfulness, should I say, your cognition isn't on, right? Over time, your first diagnosis, which isn't necessarily a true diagnosis, is insulin resistance. And that's where your cells stop responding to insulin because you have all this sugar in your body, right? So that's the first dance. Like the adrenals are stressed out, you end up with insulin resistance, your little boats in your body, as I call them, have all this sugar and they're going to the muscle and they're like, hey, I have sugar, do you need it? No, I'm good. Hey, I have sugar, do you need it? No, I'm good. Your cholesterol starts to rise. So sugar is a cholesterol problem. Cholesterol is a sugar problem, not a fat problem, which we've talked about. So when your body stops, responding to insulin, then we're looking at the prediabetes, the type 2 diabetes, or the type 3, which is the Alzheimer's dementia, which the brain becomes insulin resistant. Type 1 diabetes is completely different. It's where the beta cells aren't functioning. It's an autoimmune condition, and often, but not always, it's diagnosed up until like 11 or 13, they begin to see it. However, I just had a patient in my office last week that founded her type 1 diabetes after her first child was born, and her child is now 30. However, they did not find it until then, but that's kind of not likely in my experience and what I know in my training. So you're often going to start to see mood swings and behavioral issues and depression and cognitive decline and ADHD, right? So ADHD is so commonly diagnosed. Can we not diagnose it until we get somebody's blood sugar under control?
Yeah.
Often the children that I work with, they're eating processed foods and sugary foods and sodas and all of this, and it's just like, holy cow. Or even the dyes, right? That can throw them into ADHD. If we could only get their sugar and their eating pattern in a better place, we might not have all these conditions. I mean, there are times when there is ADHD as a diagnosis for many reasons, but in this case, I would like to not diagnose it until we get it, under control. So if we think about low blood sugar, this is what begins to happen with insulin resistance, that the body is giving you signals. You have low blood sugar, you have high blood sugar, low blood sugar, high blood sugar, otherwise known as hypoglycemia, hyperglycemia, low, high. So when you have low, you could get anxious, dizziness, that hangry that many people talk about. You could get fatigue and mood swings. You have these strong cravings, you're trouble sleeping, right? That's why I check in and say, are we skipping meals under stress? Are we eating the food, the fats, and the proteins that we need? Because often with low glycemia, low blood sugar, we have lower protein intake and lower fat intake, and we're living more on the carbs, right? Your body begins to panic at that state. Your adrenals are going to release cortisol. Adrenaline is going to raise your blood sugar, which then further taxes the adrenals. So that's low blood sugar. When we go to high blood sugar, otherwise known as hyperglycemia, we can have similar symptoms, but they are a little bit different. I would more look at fatigue after meals. I would think of bloating. I would think of heart palpitations. I would think of anxiety. I would think of drowsiness, increased thirst, frequent urination, and very low motivation. So it's kind of the same scenario where we're overeating carbs, we're eating too many sugary snacks and drinks. We could have a sedentary lifestyle, but that's not always key with hyperglycemia, and we end up with insulin resistance. So now we're creating this inflammation in the body. We're now storing fat. We can't lose weight, but yet it's never really diagnosed. Insulin resistance isn't ever really talked about until you already have prediabetes and your hemoglobin A1C is at a higher level and your sugar's at a higher level and you have higher cholesterol. Then you're like, okay, you have prediabetes. The insulin resistance and too much sugar is never talked about before that. So that's why I think it's really important for us to understand when we're learning how to heal ourselves. I want to talk about sugar cravings. It's not that you're weak, it's a signal. And it's a symptom to your body, right? It is because you have low blood sugar, you could be exhausted, your stress hormones are off, you could have some nutrient deficiencies, your gut's off, and then you're going to crave sweets, especially after meals. That tells me when a patient shares that with me that my body is using sugar as a quick fix for depleted energy. And sugar long term is not sustainable fuel. So if that's something for you, even though you might not be grabbing sugar, maybe you're grabbing more pastas or breads or something like that, say to yourself, that's still, even though it's quality and healthy, oh, that's still too much carbohydrates for my body. So finding that carbohydrate balance for you as an individual is what's important. I know that I don't do well on high carbohydrates. My carbohydrates that I get in are complex carbohydrates and vegetables. And I had to learn that over time because every time I added grains back in and quality spelt breads and things like that, I'd end up in sugar cravings. I'd end up wanting chocolate. I'd end up wanting sweets. And I knew I was into insulin resistance again. Does that make sense? So we really want to be aware of where is that coming in. And then if we eat too much sugar, that leads to inflammation. We have inflammatory cells, which now interfere with our mood or memory. Over time, this is going to affect our gut health, our serotonin and our dopamine, which are our feel-good receptors, right? Then we can start the cognitive decline. That's where the type 3 diabetes starts to step in with a blood sugar regulation. So this happens over time. You know, it's not long term, it builds over time. I put in the portal also for you to think about maybe if you're having some of these symptoms, what are some markers that you could ask your primary care physician to go over with you? I also put in some sample nutrition for breakfasts and snacks and lunches that could keep your blood sugar a little bit more balanced. But I I hope that you figure out which foods work for you so that you know that your blood sugar is the heartbeat of your energy, your hormones, your brains, and your emotions, and learning what works for you is really important. I would even suggest to take it one step further and maybe, and I know it's a pain because I don't love doing it either, but maybe think about tracking your food. And so I did have Michelle put in there a food tracker, dietary sort of that I use with my patients that you can use to track if that's helpful. It tracks your mood. It even talks about, you know, your bowels, are they regular, you know, those pieces because they're so important. So the last piece that I want to talk about is our female and male hormone health. This is really the dance of your hormonal balance. Your estrogen, your progesterone, your testosterone, and DHA, they go even further than just reproduction. They truly influence your brain and your sleep and your bone density, your libido, your energy levels, and how your body stores or burns fat, right? Estrogen is essential for both men and women. However, there's more in women than there are in men. And then testosterone is important for men and women, but men have more testosterone than women. So, estrogen does regulate our bone density, it regulates our mood, and it helps support our memory, right? So, and in our younger years, it actually regulated our menstrual cycle. Whereas progesterone is more of our calming hormone. That's why often when people start to step into perimenopause, premenopause, perimenopause, into menopause, sometimes they feel agitated because their progesterone starts to drop off and their estrogen hasn't changed. And some people get a real significant drop off and they're not getting restful sleep because progesterone is that calming hormone that helps with your mood stability and it prepares the body when you're becoming and interested in becoming pregnant. When you had your children, it prepares the body for conception. So if we have low progesterone, which begins to happen through the change of life, that can lead to your anxiety, insomnia, and right, what we just talked about, estrogen will stay high, so it's estrogen dominance and your progesterone down here. Testosterone, it helps us with our muscle mass and it builds confidence in both men and women. If we have low levels, we could have a decrease in muscle mass, we could have fatigue, we could have decreased sex drive, and even I see this more in men than women, but kind of like a sense of apathy. Lastly, DHEA is the precursor for our adrenals, and that actually converts estrogen into testosterone. And knowing that balance and understanding that on a hormone test is really important because I see individuals, like I have a lab result here, which their cortisol pattern is very low, their testosterone is very low, and their progesterone is very low. And that all feeds the cycle of what's going on for them when I met with them during their initial consult. Their symptoms now are reflected on a lab test. That's why when I give these to you in the portal, they're tests that I'm, suggesting that you may ask for your doctor for. So I did list what some of the hormonal balances could be and how they could play a role in who you are and, in the energy that you have. And so make sure that you go through that in the portal because if you have hormone imbalances, it can cause poor sleep. It can cause stress. It could be caused by environmental toxins and even blood sugar instability and gut dysbiosis. So we want to have, even as we age and our hormones change, we still want to have our hormones working for us, not against us. One of the things that I want you to think about for hormonal health is you need healthy fats. So make sure you're getting in your healthy fats like we talk about because that supports your hormone production, right? And then I did list some endocrine disruptors, but I know longer down, more towards the end of the course, we're going to be talking about, like some beauty products and things like that. But you do want to watch plastic containers because that reduces estrogen. That plastic containers can, drive to the estrogen receptors. Um, and it's really important for us to have our detox pathways open for our hormones because that's how we clear out our hormones. So every patient that comes to the clinic, I do a methylation and detox panel, which tells me how well you're clearing out your hormones and you're detoxing your body because without that, your body is going to struggle to detoxify and clear out a larger amount of estrogen, cortisol, and even toxins. So having our detox pathways open is also important so we don't end up with key diagnoses. And the key organ is for detox that I think about is our liver. If our liver becomes overloaded, it can't properly eliminate and get rid of our hormones. So detoxes isn't just about doing a 2-week detox. It's not just about doing a detox cleanse. It's not just about doing like a 5-day juice cleanse. It's really your body's daily rhythm of eliminating the toxins that you want to get out of your body. And so you're doing that through um, having a bowel movement, defecation, urination, or even sweating out, drinking enough water, moving your body, because when you move your body, you're moving your lymph system, right? And so, we want to keep the body moving so that it doesn't back up in toxicity. And there's different ways to actually do that. And I mentioned some lifestyle tips actually in your program in the Become Your Own Doctor portal that could give you some ideas to think about. So to sum it all up, we talked about a lot today. I hope it wasn't too much, but I'm like, how am I going to get this is such an important part of your body, that chemical messenger, that hormonal sort of connection, how these chemical messengers work and how they have this dance in the body doing what the body actually needs. When these systems are thrown off, that's when we start to get symptoms. So go into the portal, re-listen to this, re-listen to this live and I'm going to open it up for questions right now, but re-listen to this live and just, ask questions to me because this is a lot of information. And I would suggest maybe on each section, download one of the handouts and work through them so that you can begin to understand what actually works for you. Does that make sense? Okay. So that is the endocrine hormonal dance. So let me open it up for questions.